All right. Good morning. And I'm John Casper with the Oshkosh Chamber. Welcome to our program this morning, navigating the mental health needs of our workforce during this pandemic. We have two outstanding individuals with us today. One is Rhiann Thomas, Director of Ascension Wisconsin Employee Assistance Program, and the other is Tina Lechner, Director of Behavioral Health with Ascension Northeast Wisconsin. The participants listening in today are muted at this point. Actually, we'll be muted the whole time. And if you have questions, please use the either the chat or the Q&A tab on the bottom of your screen. I'll be looking at those as we go through, and then we'll ask those questions at the end of the presentations. A lot has happened since the last time we met. Oshkosh is, I guess, officially open for business. Some businesses are coming back, some are coming back slowly, allowing people back in. So, timing is pretty good. I was telling Rhiann and Tina, I finally got my hair cut last night. So, where you have seen me over the last couple of weeks, the man bun is gone. So it's a little cleaner these days. So, but we will be talking a lot about, mental health and emotional well-being that, people, have been struggling with over the last, several weeks as they were, quarantined at home, temporarily furloughed, laid off, and those sorts of things. So it creates certainly a lot of struggles for folks. So, with that, I think I'm going to, open it up, start with Tina Lechner. Tina will start the presentation, and then from that, we'll transition into Rhiann. So Tina, take it away.
All right, thank you, John. Hello, everyone. As John said, I'm Tina Lechner. I have the privilege of serving as the Director of Behavioral Health and Addiction Services for Ascension Mercy Hospital and Ascension St. Elizabeth Hospital. I have my colleague here with me, Rhiann Thomas, and she'll be speaking momentarily. The importance of emotional well-being has been part of the daily dialogue at Ascension, and thus, I'm hoping after today, it will further the dialogue in your organizations moving forward as well. So next slide, objectives. So today, Rhiann and I, thank you. Today, Rhiann and I are going to talk about and define our current state, discuss present risks, and really just describe hope and help for the future. Next slide. So I loved this quote, and seemingly fitting for our world today. Social distancing does not mean we are not together. So given the multiplicity of factors placing people in situations to social distance, I felt that it was an essential reminder that we are all experiencing this together. Truly, today is an opportunity to call out that normalizing feeling of unwell and powerlessness felt during this time. Next slide, please. So current state. In looking at our current state of functioning within the crisis, with certainty, we can all agree that this pandemic has changed the definition of normal, right? Pre-COVID, a cough or a sneeze would elicit a common courtesy, bless you, and now it instills a fear response. And for those of you who entered a profession other than education, you're now having to homeschool your kids and teach them math, which, oh my gosh, is painful, right? So I think our competence is all being tested. So I'm quite sure all of you can reflect on several examples, pre-COVID, post-COVID, in regards to changes in your life. And when it comes to managing all of these newfound demands placed on us professionally and personally, you're probably like me and spending most of your time adapting to the here and now. And quite frankly, we should all be proud of our ability to adapt to the change, and as this has really been our focus every day. So some of you may know this. Statistically speaking, mental illness impacts 1 out of 5 people. But with this pandemic, our number truly is 5 out of 5, leaving no one untouched. Truly, it's the perfect storm of collective anxiety, of isolation, of economic fallout, of uncertainty about our future, and increased substance abuse, just to name a few. So this type of trauma hits everyone in some way. So next slide, please. So functioning within this crisis. So from a macro level, and what does mental health care look like today? And I've heard from many, and I'm sure many of you as well, that some people are really finding the positives in slowing down and reconnecting with their families. And I think it's fair to say that many of us on the call have been conditioned to some extent to seek out the positives, and perhaps this is one of those situations. However, I've heard from others that they have found this time to be very stressful, very anxiety producing, very overwhelming. And what we do know is this stress is being manifested through increased rates of anxiety, increased rates of depression, which I'll expound on in a moment. Given the recent restrictions, which are now starting to lift, but I know that we can all relate that our routines look drastically different. Social connections are dissimilar, and in some cases have been lost. Pre-COVID, it's been well documented that as a society, social disconnectedness and isolation was beginning to be the #1 mental health crisis, and now it's just amplified. So I can tell you, one of our inpatient units on the St. E's campus up in Appleton is a child and adolescent unit. It's a very busy unit. Today we are full at capacity. And really kids are talking with us about how they miss school, how they miss their friends, how family life is just stressful. You know, virtual friends pre-COVID seemed okay, but now I'm hearing from so many kids that they are just missing their friends and they want so badly to get back to school, which as parents, we may need to remind them of that conversation, but they really are missing their school and their friends, and they're wanting some routine back. Next slide, please. So really this leads us into a moral dilemma. And what I mean by that is, given our current crisis, many of us are facing this moral dilemma to a certain degree. And what I mean is that there's this innate desire to self-preserve, right, to be safe, but we also are conflicted with our professional duty to work, right, to provide for our families. So do we stay home? Do we go to work? How do we do this? How do we balance? It's truly this moral dilemma for each and every one of us. So this is why the dialogue around these feelings and the importance of mental health and wellness is so very important right now. Next state, and next slide, please. So I recently attended a national WebEx on the various waves of a healthcare footprint. And I know I'm coming from the healthcare background, but I feel like it's really relevant to our discussion today. So really high level summary. There were various waves, first couple waves described as such. First wave, when this pandemic hit, really addressed the immediate mortality of the illness, right? The mobilization of our hospitals, of our clinics, of our services. How do we provide that? And that's kind of where our focus has been. The second wave that we've experienced is really the impact of resource allocation, meaning personal protective equipment. What do we do? How do we conserve it? Where do we get it? We have put off elective surgeries. Now, how do we bring them back? So, and just managing chronic health conditions. So that was kind of the second wave. How do we manage that? And lastly, the third wave is all about the psychological trauma, the mental decompensation, and the overall burnout we'll be facing in weeks and months ahead. So it's just a reminder that as we navigate through these waves, the mental scars, not only on our frontline workers in healthcare, but really on everyone, are very real. So next, I wanted to just touch on some present risks and some data trends. So next slide. Yeah, and you can even go to the next one as well. Thank you. So data trends. So since the pandemic, some relevant national statistics, right, and national realities. We know that substance abuse has increased over 55% since the beginning of the pandemic. Our service areas are feeling it and have seen an uptick in this. We know domestic abuse has increased, and really no real surprises. Typically, situations escalate, people can separate. That wasn't an easy option before, even though we're starting to slow back into that, but certainly that's certainly we're seeing an uptick in as well. Gun sales are up 85% from a year ago in at this time. So we looked at data from March of 19 to March 20, and gun sales are up over 85%. And the only reason I bring this up is really from the perspective of access, because in Wisconsin, we know that suicide data trends lend to higher proportions of firearm deaths than any other type. So as far as firearms go, it's truly just about access. In the Fox Valley, there's a cohort of us from the mental health communities working together, trying to manage service delivery options and meeting the needs of those in our community. And I recently spoke with the law enforcement, some law enforcement officers on this team, both from Outagamie County and Winnebago County. And the law enforcement officers in Appleton report a 150% increase in suicide-related calls since the pandemic. Winnebago County relates similar numbers, well over 100% increase in suicide-related calls that their teams are having to go out and investigate. And really the officers have expressed concerns about the sustainability to manage the demands truly at this pace. So that's why the collaborations are working together to try to think creatively on ways we can assist our law enforcement officers. I also have the privilege of serving on the NAMI board. NAMI is a National Alliance for Mental Illness. They run a peer run respite called Iris Place up in the Appleton area. They manage a warm line, which is a phone line that just is there to troubleshoot, brainstorm, talk with people. Anybody can call. They usually averaged about 300 calls a month. They are now averaging over 1,000 calls a month, taking calls from people in our communities. Just stress, what do I do? Where do I go? How do I manage this? So the numbers are astonishing. I know the National Mental Health America stats report a 70% increase in anxiety from January to April. Depression is at a 64% increase. So we can see the numbers escalating. I'm sure they go on and on. So just giving some of that insight. Next slide, please.
Tina, you muted. You accidentally hit the mute button.
Oh, thank you. Thank you. Wanted to touch base on competing harm and what I mean by this in regards to risk. You know, in a time when suicide rates are increasing nationally, state level, locally, you know, understanding risk, I think, is a must for everyone. You don't have to be in healthcare to understand risk. I mean, it's everywhere, just understanding what we mean when we talk about risk and how it relates to prevention and postvention planning. So in behavioral health, in our world, we talk about things like risk factors and protective factors. And so in a pre-COVID state, risk factors are complemented by protective factors. In a COVID state, risk factors and protective factors are competing harms. Okay, so let me explain what I mean by that. So since the pandemic, we know there are a high number of risk factors: social isolation, lack of access to gyms, to stores, to churches, to families. There may be relational discord, misuse of alcohol. I mean, we know there's tons of risk factors out there. So as clinicians and clinically, what we try to do with risk factors is balance them with protective factors, our protectors. So unfortunately, our protective factors are not readily available in this current state, right? So for example, if you're isolated, we're telling you to stay isolated. If you found strength in your church support group, you can't go. If you use the gym as your outlet, you need to look at an alternative. If your work was an outlet and now you've lost your job, that goes to the risk category. So you can see, you know, through this pandemic, our risk and protective factors are really competing harms. Now, that being said, there are ways to work around that. It's not completely doom and gloom. We as clinicians can certainly help with that. And all of you can help with that, but it's just understanding why are things so hard right now? It's just an easy way to look at an explanation for that. So next slide, please. So this brings us to, right, our perfect storm, risk and protective. And as we continue to watch daily and hope that that curve continues to trend down, I'm anticipating, and the literature out there is anticipating, that the psychological drama of this will persist for months to come. And the need for behavioral health services will be on the forefront. So even though the scale of disruption has been massive, no doubt, the response from our mental health community has been expansive. We are blessed, and Rayanne's going to talk about this, but we are blessed in our counties to live in a rich mental health resource county. We have a lot of people wanting to help, and we have a lot of resources and players that are out there to help with our workforce, with our community members. So I mentioned earlier about the importance of incorporating mental health into your day-to-day dialogue or workflows, and Rayanne's going to talk about that now, but just knowing that it can be done, there's help to be had, and certainly through this, there certainly is hope, and that's why we're here today. So I'll turn it over to Rayanne.
Thanks, Tina. So I'm going to talk a little bit about how mental health comes along with your employees into the workplace, or becomes part of the work environment they sit in when they're working remotely. And as Tina said, this has become the perfect storm for us. Mental health issues have always been a challenge in the workplace. We, from an EAP perspective, do a lot of work in that area, but we can't look away now or minimize them now, because even people who generally are doing quite well are starting to feel anxious and exhibit signs of, anxiety, depression. I think one of the things that contributes to that is the lack of knowing, what's coming tomorrow. When kids don't go to school every day, they don't have a routine that helps them feel safe, and they can control their existence in their life and that kind of thing. And our adults are feeling the same way. We don't know what tomorrow is going to bring, what changes will happen, and how we'll have to adjust to those things. So your employees who are coming into the workplace are dealing with all of that uncertainty at home, and your employees who are working remotely are trying to kind of mitigate all of that chaos at home so that they can look like they've always worked from home, and this virtual stuff, they got that hands down, right? The challenge for you as people leading in your businesses is that this need goes beyond just that single employee who's coming in. Family members, extended family, that's a complex network of people who need multiple supports. Sometimes you don't even know all of the people who are kind of sitting behind that employee in need of a service. So the next slide, we'll talk about some hope for the future. And essentially there, I just want to tell you that the good news is you don't have to save everyone. This pandemic has uncovered a lot of areas of issue and need for all of us. And we can't just keep plugging the holes in the boat. Really right now is the time we need to think about switching boats. So I was just on a call with the EAP staff. We have Wednesday morning staff meetings, and we talked about that, considering what delivery of our services will look like and how we can be accessible and valuable to the companies we serve. Our on-site services may look different. Our face-to-face counseling may look different. It does right now. And how will that evolve over some time? So not only do we have to consider change, but we kind of have to get up and embrace it. It's coming, and things are not probably going to go back to the way they looked before this. And I would encourage you to reimagine for yourself different ways of doing things in your workplace. you know, people don't make change for fun. They make changes for necessity. So we'll talk about that in a second. But we have all come to work every day. We've known what to expect, and now, I mean, I'm sitting in a home office with 2 puppies behind me, and if someone drives into this driveway, all bets are off. Those dogs are going to go nuts, and I'm not going to look so professional anymore. And you have employees at home that are dealing with the very same thing. Next slide, please. So your influence in the workplace. In times of change and uncertainty, what teams really need are your leadership. And I'm talking about the people with the titles in your organization, but I'm also talking about the people who are non-titled, but are influential on your teams. You know who those people are. When you need something to happen and you need buy-in, you can notice who those people are, and their reaction to whatever is announced helps the whole team kind of go in that direction. So that kind of leadership is super important right now. You don't need to have all the answers, but you need to be genuine and sincere in your leadership. So looking out for them, admitting that everything isn't rosy for everyone is really important right now. We do this initiative inside Ascension, and we're rolling this out to our external EAP customers called We Care. And it's a way of being with people. It's a compassionate presence to acknowledge people's challenges. Sometimes they're suffering, sometimes just their uncertainty, and not taking that problem and fixing it and bringing back to them all shiny and new, but really acknowledging what they need to go through and helping them maybe find some resources, or just validating that, yeah, that sounds really hard. So you don't have to feel like you need to save people from their problems, but you as a leader, influential or titled, can notice things in your workplace. You have relationships with people in your workplace, so you can notice when they just seem a little bit different. Maybe they're a little quieter, maybe they're a little more chatty, maybe they're a little more edgy. That's a sign that they're coping with some things, and those additional challenges for them are the thing that piles on enough that eventually, if there's a mental health issue, you know, pre-existing for them, it might bubble to the top. Or even if there's no mental health issue for them pre-existing, it can bring on some new anxiety, new depression, that kind of thing. So from a workplace leadership perspective, this is not the time to try to do it alone. You don't have to figure everything out, find every resource. This is the time to lean on your human resource department, your own employee assistance program if you have one, other community resources, mental health. I mean, the chamber bringing us in to even talk about this is a great awareness tool to say, oh yeah, you know what, I'm just gonna have that in the back of my mind. You're not going out diagnosing people. You're not putting a treatment plan together. You're not getting the psychiatrist to sign off on the treatment plan. You're just noticing and saying, you know, I could try to help you find some resources if you feel like that would be helpful to you. So your compassion toward your employees or associates, whatever you call them, is really, really important these days, being there with them, in it with them. So the next slide, we just want to acknowledge that everything wasn't perfect before COVID came along. We already had employees who had work performance problems. Some of those are mental health or addiction related, and some are not. Some managed them really well, and some never did. And you probably all can think of someone in your mind that you are leading who you think, yeah, on any given day, I'm not sure the reaction I'm going to get from that person. And what happened then is we fall into this pandemic, and COVID just turned up the volume on all of these things. So people who were having a little bit of trouble working together or coping with change are now having a little bit more trouble working with or dealing with the change. And then you add on to that what Tina was saying before, the idea that people are coming home to homeschool their kids. And I, for one, never signed up to be a teacher. That's not going to be a strength for me. Getting lunch on the table, emotional support, people who are furloughed and are worried about money, job security as your companies change and you retool the way you look and your mission and what you're delivering and how that might look, your employees get scared. They're not sure, you know, are you going to need me? If you need somebody in this job, are you going to need it to be me? Do I have the skills to do what's coming? Well, you know, again, I talked about this in my staff meeting this morning, and even the counselors, these are people who teach coping skills, and they are saying, somebody said to me, I'm getting scared about this. I don't know what this is going to be like. It makes me nervous to talk about it. And I said to her in the midst of the meeting, we don't have to talk about it now, but we have to talk about it. So why don't we meet one-to-one and talk about what your concerns are so that I can at least hear that. And I want you to know, this would be something you might say to your employees, I want you to know I care about this. I want to do right by you, and I will hear what you say. I may not be able to give you everything you want, but I will try to factor in your concerns into any decisions that are made here. So the next slide, this kind of boils down our we care response internally. So Ascension has kind of branded this response as we care. And really what it is looking for opportunities to show support, listening carefully and compassionately to people, and linking them to resources. And the two things I want, or the three things I want you to know about this is looking isn't just, you know, what you decide in your office about how you're going to approach people. It's really being out there with them and noticing when people who've been really steady for you in the past are struggling a little bit, or people who have needed a little extra support in regular times might now need a little bit extra support. They'll show you even if they don't tell you. Listening carefully is really, really important. And no disrespect intended, but I want to tell you that 99% of the people that I talk to or that I'm aware of think that they're better listeners than they really are. So a lot of us listen for the point of disagreement, listen for the point where we can jump in and fix them so that we don't have to listen anymore. Sometimes we get judgmental and we didn't even realize we were getting judgmental. It's just that they have a different life philosophy than we do. So listening is super important. It's about being able to repeat back what people say. Is this what you meant? Did you say it like this? Is this the feeling that you're describing? Listening is from a curiosity standpoint, and your goal is to be able to say, I get it. I understand what you're saying, what you're thinking. You're not listening to fix. I think if you embrace that definition of listening, it makes it easier to go out and listen to employees. We hear people say, I don't want to go listen. What if they tell me something I don't want to know? You know, Tina's talking about the suicide hotlines and gun sales and things. Oh God, what if they tell me that kind of thing? What am I going to do with that? And we're saying, if you listen compassionately, you're going to hear from people and you're going to be able to validate, that sounds hard. That seems tough. Would there be something I can do for you right now? Shall I find some resources for you? Can we just sit down? I'll get you a glass of water, and maybe I can find another specialist to talk with you about this and help you in ways that I might not be able to. And that linking to resources is really important. The idea that, you know, there are lots of resources out there. Your EAP is one, but 211 is a great resource. If you don't know where to begin, that's a great place to start. But don't discount the fact that you yourself are a resource in your compassionate presence with your employees. So I don't want you to hear this from the perspective of, oh, great, one more thing to do. But, you know, we say all the time, right? Your employees are your greatest asset. They make the company work. The ideas don't get produced into real life until you have the employees to do that work. So the best leader gets nothing done if they have no one to lead. And taking care of those employees from a compassionate perspective, not a saving them kind of perspective, but just compassionate, is really, really important. So the next slide, we talk about the silver lining. And, you know, I just gave you all this information and said, do these things and you can be helpful and you can be influential. And I want to take a step back a little bit and say, I don't want to put this all on your shoulders. But much of what we experience these days feels really hard. I mean, even if things are going in a good direction, it's harder. So people tend to carry a lot of negative feelings. They sort of look for the thing that's going to go wrong. But in trauma care and in mental health generally, there's this phenomenon called post-traumatic growth. And it can be something that your employees experience through this process. So finding the traumatic growth opportunities isn't what we can do for others, but it's something we can model for them, or we can remind them that that's a possibility. And if you just personally think back to something you went through that was just hard, it was just a tough, tough time, and reflect on that a second, and then think, oh yeah, I came out of that a little bit different person. I learned some things, I prioritized some things, I realized what was important to me, those sorts of things. That's post-traumatic growth. And just like you and I can feel that, so can your employees. So that's an upside to this. People who already are resilient are going to be able to find that silver lining pretty easily after the fact. Believe it or not, people who are struggling a little bit more might need a little more support around that. And it is not us giving them the silver lining. It is them reflecting and really finding that for themselves. So some of the work we're doing these days in EAP is around resilience and helping people build that strength. So you can find lots of information about resilience on the internet if you don't have other resources for that, and try to build a little bit of that in, acknowledging people, validating where they're coming from, pointing out their successes and what they've already done well. Their coping that has already been a good thing. So from an EAP perspective, yes, we attend to those serious mental health issues in the workplace. And we try to kind of promote that positive work environment, positive culture, to keep your well people well, because those people have a great deal of influence on your work culture, and you want that kind of influence on your work culture. So I probably went over a little bit. I'm sorry about that. And then the next slide is just our summary slide. So we talked about our current state, how this is different than any state we've ever been in before. We talked a little bit about our present risks, people being isolated, fearful because they don't have routine, worried about what the next thing is, and nobody knows the next thing, right? That's the tough part. So those risks are hard. And we've also Tina did a great job of talking about protective factors. So yes, there are those hard things that we have to cope with and manage, but there are also protective factors that help people cope, even if they're not the same old protective factors that we were able to use before. We might notice some other new things that help us to stay well. And then finally, my part of the presentation was talking about what you can do for your workplace, how you can be present to people to maintain that asset, and looking at hope for maybe a little bit different future than we've ever had before that might be full of possibilities. So that's all I have for today. I'm happy to stay and take some questions, and I know Tina will have better answers than I, so we'll collaborate for you.
I don't know about that, but if I could just add one thing, and thank you, Rand, you did a great job. You talked about the silver lining, and one thing in mental health, we hear a lot about stigma, right? Like, that doesn't happen to me, and I don't want to talk about it, and there's stigma associated with it. And I guess if there's a silver lining in all of this, and I talked a little bit, much like Rand, about the need for dialogue around this, is hopefully by having dialogue around emotional well-being, mental health, mental wellness, we can melt away a little of that stigma with regards to emotional well-being. So for that, I'm grateful for the opportunity to have the dialogue around the importance of this.
Well, great. Thanks, Tina and Rayanne. We've gotten some questions that have come in offline, so I'll try to answer those. If anybody else has any questions, please feel free to use the Q&A tab or the chat tab. We'll take those. But question is, from the moment you wake up in the morning to the moment you go to bed and everything in between, all you hear is a COVID update, status report, whether it's more, more people getting inflicted, more people, passing away and that sort of thing. But and people take that, they bring it into the world of work. But it's hard to get away from that. It's 24/7. But are there any ways that you would suggest that employers can, things they can do within the office or in their environment to keep people energized, keep them motivated, keep them, looking on the bright side, if you will?
Yeah, I think this is Rayanne. I'll take that one. First of all, from a personal perspective, encourage your employees to limit their media consumption. When we're all on computers all day long, or many of us anyway, that can be kind of hard to do. But find your source of truth, find your single source of truth and go there. Maybe once a day, maybe twice a day for information, and leave it at that. In a way, this is very reminiscent for me of 9/11. For the people who are on this call who remember back to the Twin Towers and the airplanes, that kind of stuff, I remember counseling clients who talked about not being able to sleep. And all of a sudden it dawned on me, where are you sleeping? Is the television on? And they would sleep with the TV on, and the same news stories over and over and over on 24-hour news now. So limiting your consumption, and sometimes it's helpful to remind associates and employees about that. You don't have to listen to the news all the time. The other thing is, I think people listen for that in case there's one new thing, in case there's something that changes. So what I would say about that from the workplace is, let your employees know you're going to communicate with them in a very timely way. You're going to be as transparent as you possibly can be, communicate in a couple different ways. Nothing beats face-to-face talking, but face-to-face in meetings, by email, memos, posting things that you want them to know about, because I think people gravitate toward that excess consumption because they're afraid they're going to miss something. So if you commit to communicating with them at work and say, I'm going to let you know if there are changes about the way we work and and what we deliver, I think that helps people kind of settle down a little bit. Does that make sense?
Yeah, if I can add to that, and that's exactly right. Distancing, much like Rayanne said, she hit it head on. The other thing I would add to that is really, think about what brought you joy in the workplace pre-COVID, and really start to think about integrating some of that back in, right? I mean, we're adjusting to change every day. Our schedules change, our workflows change, our delivery has changed, moods, behaviors, all of that. But, maybe just thinking back, okay, what really worked for our employees before? Like, what was something to look forward to? What brought you joy before? And can we integrate that back into our work life to get back to some of that positiveness within the environment? So think about that. Because I think we put everything on pause, but it's time to unpause, if you will. And we talk as an organization too. It's much easier just to shut everything down. The hard part is turning the lights back on, right? So how do we do that again, and really go back to what worked before?
This whole COVID-19 issue has caused people to change, or organizations to change, but not everybody is accepting of change. A lot of people are very risk adverse, as a matter of fact, at changing. So is there any methods, any things that employers can do to help their employees to better embrace change, especially now that we're reopening and people are coming back to work? That work environment may be different. So any thoughts, any approaches that employers can utilize?
Yeah, so I don't have this committed to memory, but if you have a chance, Google something called Change Matrix or Change Management, Managing Complex Change Grid, something like that. That grid lays out a really nice kind of plan for how to help people get engaged and buy into change. And essentially, it's about meeting the needs of the employees around what is the mission? Why are we changing it all? What's the big idea of this? What resources are we going to need? And here's where we're going to get those resources. What's in it for me? Why would I even want to change? This is, you know, this doesn't feel good to me. It's just extra effort. So telling people what's in it for them, and there's nothing wrong with that. That is not a dark thing. We do not come to work to be altruistic. We come to work so we can make money for the fun things we want to do in our life. So the what's in it for me is not a bad thing. And then a plan. If there's another area of this that I can't remember right off the top of my head, but finally the plan, how we're going to change. And if you can communicate those areas, the mission, the resources, the what's in it for me, the plan, to your employees, you're going to help them better buy into the change. And if they're not buying in, sometimes we're just missing one of those points. So sometimes it's just talking with them about what part about this scares you? What don't you like? What, you know, what is unmet that I can help you meet so that you can buy into this? Because nothing beats a direct conversation about what do I got to do to get you on board here?
Yeah, I would agree with that. And just remembering that a lot of the angst and uncertainty and unsettledness is fear-based, right? So maybe taking that moment and saying, okay, let's have it. Like, what is it? What can I help you with? And really, as you walk through that, then really acknowledging those morsels of change that you see in your associates, right? So, you know, we as leaders, and if some of you on the call certainly are leaders in your organization, I mean, if you're a leader, you're always a leader, right? So, you know, really acknowledging those attempts, however big or small they may be, for your associates, that you notice, that you appreciate them. I mean, I'm a strong believer, if you breathe in gratitude, you'll breathe it out too, right? So if, you know, be grateful that we are here, that we are working, that we are able to make a difference, and that we can all be together. And, you know, I mean, finding the positives and capitalizing on some of those. But to Rayanne's point too, you may have to call it out, right? And really, it may not be about the issue you think in the workflow. It really may be about something totally different. And often it's fear-based.
You know, there's a lot of information out there. You get from the national media, local media, and then there's stuff on posted online, varying degrees of how severe the COVID-19 issue really is. Is it this pandemic that, you know, some have claimed and some have claimed it's not anywhere near how we're responding to it in terms of creating that fear. So in organizations where you have kind of a mixed bag of different opinions about that, you know, how do you manage those things in terms of, you know, some people on one side of the spectrum are kind of, you know, sloughing it off, and some people are just, you know, just ultra sensitive and ultra concerned about you know, what may happen with this.
Yeah, I would say you start where the person is, right? Because you are going to see that mixed bag of some people are really anxious about current state, and other people are like, you know, yeah, they're making more of a big deal. It doesn't really matter. This is blown out of proportion. So, you know, as an associate or employer, I mean, I think everyone's going to approach it different. Therefore, you have to start where the person is and provide some guidance as to where you need to go with that. So you're, much to Rayanne's points earlier too, you're not going to solve it necessarily. It's not yours to solve. You're there to listen. You're there to start where the person is and be a resource for them. Rayanne, anything else you can add?
I would agree with that. And I would just say that, you know, this is where your management skill comes in as well. From a workplace, people do not get hired to come in and convince everybody of their own spiritual, political, financial philosophy. They're there to do a job. So while you can listen to someone and say, I hear what you're saying, I understand your point of view, doesn't mean you have to agree with them. It doesn't mean, though, that you need to change their mind. What you need to do is define what you want from that person within the scope of their job and ask them to deliver that to you. This isn't about getting everybody to think, you know, oh, those gun sales are a bad thing, or those gun sales are a good thing. You know, it's not about that at all. What it's about is, when you come to work, can you do what I need you to do that is defined as your job? You know, I think more and more, I think probably because of social media, people are more out there about their opinions now. And so we hear them and we know them. In the old polite days, right? You didn't talk about religion or politics. That's what my mom always said. Don't talk about religion or politics. Well, now we kind of know that stuff, sometimes accidentally. And I would say, again, where you can, reserve judgment about that if somebody differs from your philosophy. But when they come to work for you, it is to do the job that you are defining for them. And as long as they're doing that job and doing it well, I don't think you want to concern yourself with changing people's minds about things. You have them there coming to do their jobs.
In the new environment we have to work with, in terms of kind of keeping separation with among staff and the like, any ideas about how do you do some, are there some good team building exercises you can do where, you know, you can kind of get people together and, you know, keep them motivated without getting them together?
That's hard these days, you know, and I think it can be easy if you have an employee base that's like very, very comfortable with technology. But if you have employees who are not so comfortable with technology, it's going to be a challenge for you. But I would say you want to commit time to that team building kind of thing. So in my team, for example, I have people who hate the computer and the virtual work, and I have others who love it. They think, oh, it's about time we're doing this. So I try to pair people up and work together virtually on projects so that they're not feeling like they're all alone or it's only them out there. We try to get together virtually. I know when people are coming into work, you don't necessarily want to gather all your employees in the same room, but there might be other ways that with the help of technology that you can bring people together, sort of kind of a common experience. So we're all going to take 5 minutes and, you know, think about, well, like Tina was saying about gratitude, we're all going to focus for just a minute on the thing that we're grateful for, or the things that we're thankful for. So you can cause people to behave in a team environment, even when they can't be together, by like managing a common experience for them. That might be something, but you may be able to get creative and ask your employees themselves, how do they want to engage with each other? And then keeping in mind your policies and your protocols around the distancing and the safety measures we need to have in place these days, try to build in some of the things that your employees are asking for to create that team feeling, because they've got ideas. They just don't say them because they just weren't asked. But they'll be even more invested if they get to have some input.
Yeah, here's one thought, and this was something that happened at our organization. You know, I have my VP had, you know, wanted all of us to commit to showing your face, right? Because none of us want to show our face on our screen. So we had our meeting set up and, okay, everyone's got to show their face. You know, instead of doing what we thought we were going to do, we did this Jeopardy game, right? Which had something to do with work and what we were doing. And none of us really knew what we were doing, but it was kind of fun. And it wasn't like, oh, this is, you know, what are we going to talk about today? And same stuff. So, you know, be creative or tap into that creative associate that you have who loves to make up that stuff. You can do it work-related, non-work related, however you want to do it, but it might be a nice little surprise to do with your associates and incorporate your work, but in a different sort of way, virtual way. Again, I'm not one to create the Jeopardy game, but somebody much more talented and innovative than me could do that. But I can tell you, we were laughing. It was so much fun. And as a group, it was just refreshing.
I think we have time for one more question. I had one that came in. It's kind of long, and I'll it's not easily summarized, so I'll just kind of read through it here. As healthcare professionals, do you or your organization feel as though the key decision makers who are issuing these extended lockdown rules are really in touch with or aware of the total societal cost involved beyond just the singular COVID focus? Such as, do they understand the mental health impact on citizens? Whether it's gun sales, substance abuse levels. Do you have any sense in terms of, key decision maker, whether they, are aware of those inputs?
I would just say I have a great deal of confidence in our leadership, in the transparency, the amount of communication that's provided to associates, the amount of support that they have built and delivered to our associates across the Ascension system. They truly show, they model what they're asking us to do with our patients and our communities. I think they also have a great deal of understanding that people come at this from very many different directions, not just the right or the left, but very many different directions. And they have great sensitivity to that. And just like I spoke about earlier in the presentation, I think they do have some understanding that they cannot fix this for everyone. They can link to resources, they can acknowledge, but they cannot take every associate's problem and fix that and give it back. So, and finally, there was no real good playbook for all of this before it started. So some of it is working on your feet, and figuring out the right thing. And I have seen a great deal of wisdom and humility come from our even most senior leadership in our system. So I know it's hard, and it doesn't always look like, geez, they didn't think of that, or they didn't do that right. They didn't consider this or whatever. But I can tell you, working inside this system, I have been nothing but amazed and inspired by the way our leadership has walked us through this. They're walking with us. They're falling from an ivory tower.
Rayanne, I know we're getting low on time, and you mentioned resources. Is there another slide on resources, I think, before we are out of time? Wasn't there a last slide on just some links? Did we include that? Or if not, we can get it to John.
Yeah, John, I think there is one more slide.
Gosh,
I'm sorry.
I don't have access to that, but
Okay.
It's here. It's up.
is it up? Okay.
Yep, it's up. So healthcare.ascension.org is a COVID-19 website. That's an awesome website. And it's a living website. Things change on there. They're updated, they're added. So that's a great place to go. The CDC has absolutely wonderful information. The challenge is there's so much stuff in there. So go to cdc.gov. Coronavirus 19, there's a lot of coping stuff in there. And then there's stuff even specific to anxiety and stress, which I think will be the thing you'll probably hear most from your employees, is that I'm stressed. I've got so many things to manage. So these are great places to go to start.
Okay,
Well, and I think there's some tools in there that promote resilience as well. So good stuff.
Fantastic. Well, thank you. Thank you all for joining us today. I'd like to again thank Rayanne Thomas and Tina Lechner with Ascension in joining us and putting this program on for us today. Just a reminder, tomorrow at 10 o'clock, we have on our virtual town hall session, we have Congressman Glenn Grothman joining us. So there's been some activity within the House in terms of I don't know if it's a third or fourth or maybe fifth piece of legislation that they're trying to start a conversation, apparently legislatively, to advance another stimulus package. So we'll see what insight the congressman has on that. Again, with resources, the chamber has our webpage on the coronavirus site. A lot of information from CDC, from healthcare providers. What's been of utmost importance in people's minds is return to work. we put together a return to work best practice document. So if you're looking at that, please, please use those best practices that a lot of essential businesses have been using in the last several weeks. The main thing is you are open for business. Be cautious out there in terms of making sure environments are such that people feel confident, people feel safe, whether it's your employees or customers. We have been doing a lot of different things. We're selling protective face masks and also sanitizer, two things I thought we'd never be in that business, but we can source those things at high volume and pass those on to members here. So please connect with us if you're in need of either of those two things. So with that, again, thank you very much for joining us. We're continuing these in the next weeks ahead, and we'll see you hopefully next time. Thank you very much for joining us.